Today we're going to talk about the terminal branches of the brachial plexus, their course through the upper limb and the muscles that they innervate and so on. So our branches that we're going to talk about today are the axillary nerve, the median nerve, the radial nerve, the ulnar nerve, and the musculocutaneous nerve. So we'll begin with the axillary nerve. The axillary nerve will go behind the inferior border of the subscapularis muscle, and it goes posteriorly like this with the posterior humeral circumflex artery. And obviously the axillary nerve will innervate the muscles in this region, which will be the deltoid and teres minor. So deltoid and teres minor. From this we conclude that the axillary nerve will give muscular branches, and also the axillary nerve, matter of fact, it gives cutaneous branch for the posterior aspect of the shoulder, and it's called the superior cutaneous brachial, or the superior brachial cutaneous branch. Superior cutaneous brachial branch for the posterior aspect of the shoulder. This is the axillary nerve. The median nerve, as we know, it originates from the anastomosis of the lateral and medial cords of the brachial plexus, and at the point of its branching, it lies anterior to the axillary artery, but the axillary artery then changes its name as it courses through the arm to become the brachial artery. So the median nerve will go like this. In the beginning, the median nerve will be lateral to the brachial artery in the course, and then it will become more medial, and it will go all the way on the medial side until it reaches the medial bicipital groove. It perforates the bicipital fascia, and it goes all the way to the wrist, and then it gives some branches. So the median nerve, first of all, it gives muscular branches, and the muscular branches are for the flexor compartment of the arm, for this region. And this region contains all the flexor muscles, so they will be supplied by the median nerve, except for two muscles which are nearer to the ulnar nerve, so they are innervated by the ulnar nerves. These are the flexor carpi ulnaris. Obviously, from the name, it lies in this region, so it will be supplied by the ulnar nerve, and half of the flexor digitorum profundus. Flexor digitorum profundus, it has 4 tendons. 2 of them lie near to the ulnar nerve, so they are supplied by the ulnar nerve, not the median nerve. Other than this, all the muscles in the flexor compartment are supplied by the median nerve. Also, we have the anterior interosseous branch, anterior interosseous branch, which supplies the muscles. So interosseous, so it lies in this region, and it supplies the deep muscles of the flexor compartment. Also, we have a palmar branch. Matter of fact, when the median nerve goes to the hand, there's something which covers the carpal bones here in this region. It's called the flexor retinaculum, like this. And it forms a tunnel. So if the carpal bones are like this, this will be the flexor retinaculum, forming a tunnel, and the median nerve actually goes through the tunnel, but the palmar branch will go superficial. It will not pass with the median nerve through the carpal tunnel. So the palmar branch will go above the flexor retinaculum, or be superficial to the flexor retinaculum. And again, the median nerve will give muscular branches for some muscles in the tenory region, and like the opponent's pollicis, the one which is responsible for the opposing movement of the thumb, this movement, the opposition is called opponents, but the other two muscles are not, the adductor and the flexor are not innervated by the median nerve. So muscular branches, and we have common digital branches, 3 of them. And I'll show you the pattern of the innervation of the median, radial, and ulnar nerves in the dorsal and palmar sides of the hand after we're finished with the course throughout the upper limb. Also, the median nerve innervates some lumbricals and some interosseous muscles in the hand.